My name is Maria Campos, and I am the Director of Clinical Services here for South Coast Behavioral Health. Working in the industry for over 10 years, I've made it a point to be part of the program from the client's perspective all the way up to someone being at a clinical director level. So part of what we do is I don't run the ship as just me being an authoritarian on how we do our business. I'm more of a collaborative person where we learn from our clients and our staff what are things that we're seeing, underlying trends, patterns, things that are really going to help our clients be up to date with what they need to learn how to thrive and go through a life of resiliency. Like I mentioned first, collaboration. Also, we look at evidence-based practices. We have a clinical team that's diverse in knowing different therapeutic orientations. Not only that, we also promote our employees to enhance and improve their education by being able to take on additional therapeutic orientations so they could be able to have a wider background on how to support our client care. We're trauma-informed care, first and foremost, on what we are and how we work on our approach. And by trauma-informed care, it's providing safety, giving guidance, using evidence-based practices. But I'm a huge believer of partnership and collaboration, whether it's myself partnering with my staff or partnering with a client and meeting them where they're at. There's no such thing as cookie-cutter treatment. And so we have to live that standard of not giving cookie cutter service. A lot of times people come in with panic. So to have someone feel a little bit more prepared and comfortable in being here in treatment is to, one, praise them for making a really hard choice, because many times they're leaving a life behind where there are family members, friends, even work that they don't know will be there, but they have to take that risk. Aside from praising them, we also go into normalizing that you're doing something that many people struggle from, and many people have the opportunity to endure and have been able to endure. So we even let them know what are the things that they're going to have here to help normalize this experience. We also have staff who have been here with us many years ago who are alumni, and so they're like the living success of how going into treatment is the best choice. So not only do we, promote it and discuss it, we actually embody it by having people here who know the other side. I'm a late starter. When I got into being in this field. I grew up in addiction, but being in a Hispanic culture, we normalized addiction, and more when it comes to the level of alcohol. So I grew up seeing alcoholism in my family for such a long time, but never realized it was a trauma, or even that I was exposed to being predisposition that I myself one day could follow the path, especially because it's normalized. I've always wanted to help people. I never knew how. I worked in multiple industries. Finally, I got into an opportunity to work in mental health, and now I've been in the industry working in mental health for at least over 11 years. I like our clients to learn from life, or even to learn from things they can associate with. And for me, I want them to not need me. And so a lot of times, they're like, well, I don't understand. I was like, well, have you ever watched Nanny McPhee? And they're like, no, what is that? I'm like, well, it's a great movie about teaching people how to be self-empowered. There's a part of the movie where, to help people understand how long she's going to be there, it's when you want me and you don't need, when you need me and you don't want me, I'll stay. But when you want me and don't need me, I'll go. Meaning, I don't want you to need me. I don't want you to need our program. I don't want you to need us. But that means our team has to have done everything that we could do to ensure they don't need us. And that has to do with them building their family connections, them being able to look at continued care, being able to look at, finding their own way of doing their own 12-step, whether it is AA, going through Smart Recovery, doing Refuge Recovery, or any faith-based recovery that says, I can do this and I don't need you. It sounds harsh when we hear it, but honestly, that's what treatment is all about. Whether I'm working with someone in mental health or working here in substance use disorders, I want you to get to a day that you don't need me. But it's nice to know me.